Thank you so much. I'm really pleased to be here today. I'm actually here presenting on behalf of my colleagues, Joseph Friedman and Stephanie Strathsey. Joseph really wanted to be here. He was planning to be here, unfortunately had a run-in with a wild dog and broke his ankle a couple weeks ago, so is recovering from that. But I'm very happy to present their work looking at illicit fentanyl use and hepatitis C seroconversion among people who inject drugs in Tijuana and San Diego. Results from a binational cohort study. This has actually recently been published in Clinical Infectious Diseases, so I encourage anyone with additional questions to read that instead of ask me. But anyway, we'll take questions. It's fine. Okay. So you already saw the slide, Megan showed it. Hepatitis C incidence is rising in the United States. Acute infections are rising, and this is occurring within the context of an increasingly contaminated drug supply with fentanyl, which is also resulting in escalating overdose rates. Fentanyl is known to be driving these sharply increasing overdose mortality in the United States, but its association with hepatitis C and other infectious diseases is unclear. Fentanyl does have pharmacological properties like a short half-life that could increase the risk behavior for infectious disease transmission, such as frequent injecting drug use and syringe sharing. But really that's speculative, and there's really no data that exist that really look at the potential link between fentanyl use and hepatitis C or HIV transmission. So our aim was to do so using data that Stephanie Strathsey has collected. And so the aim of this study is to assess the relationship between fentanyl use and HIV and hepatitis C seroconversion longitudinally among a cohort study of 398 people who inject drugs. This is a binational cohort study. San Diego lies along the US-Mexico border and is contiguous with Tijuana, Mexico. So this was a longitudinal cohort study of people who inject drugs who reside on both sides of the border in San Diego, California, and Tijuana, Mexico. It was conducted between 2020 and 2024. This is the La Frontera cohort. Participants were recruited through an outreach mobile van. Eligible participants were over 18, reported past month injection drug use, spoke English or Spanish, and resided in either San Diego or Tijuana. The survey followed participants longitudinally and did repeat HIV and hepatitis C serological rapid testing, as well as semi-annual interviewer-administered surveys. And we did Cox regression to examine predictors of HCV and HIV seroconversion, considering self-reported fentanyl use as a 6-month lagged time-dependent covariate. So I'll reemphasize this was self-reported use. So overall, hepatitis C incidence was about 14 per 100 person years in the cohort, but if you see here in the middle, hepatitis C incidence was higher among people who inject drugs who reported fentanyl use at about 24 per 100 person years compared to 12 per 100 person years among people who inject drugs who did not report recent fentanyl use. We also saw higher hepatitis C incidence among those who were unhoused. Roughly half the cohort were unhoused, as well as higher incidence among men. Fentanyl use significantly predicted hepatitis C seroconversion in both our univariate and multivariable models. So the adjusted hazard ratio was 1.57, 95% confidence interval from 1.03 to 2.40. So that hazard ratio showing the increased risk of hepatitis C seroconversion among people who inject drugs who report fentanyl use compared to those who do not. And that was controlling for receptive syringe sharing, sex, heroin use, and age. And when we adjusted for city of residence and other characteristics, it did not appreciably impact our results. Interestingly, we saw a similar magnitude of effect in that relationship between fentanyl and HIV seroconversion. However, the small sample precluded further analyses. Our HIV prevalence is relatively low. And so you can see here at the bottom that the overall HIV incidence was 1.29 per 100 person years in the cohort. It was 1.0 incidence per 100 person years among those not reporting fentanyl use, and 2.3 per 100 person years among those who did report fentanyl use. But again, that was not statistically significant because of low power, so we really need more data to understand that relationship. And overall, this is the first evidence that fentanyl use may be driving increases in hepatitis C incidence. I think we really need more studies to understand these potential causal mechanisms and whether this is indeed a causal relationship. As I mentioned, the short half-life of fentanyl and leading to frequent injection syringe sharing is known, but our association remained even after controlling for those factors. In vitro studies indicate that fentanyl enhances hepatitis C viral application, so whether there's a transmissibility aspect would be interesting. But additionally, possibly fentanyl has a destabilizing effect on the lives of people who inject drugs, and the associate polysubstance use reported among many people who inject drugs who use fentanyl may decrease healthcare and prevention engagement and be involved in this as well. Overall, in the United States, hepatitis C elimination has been prioritized as a goal by the White House and will likely require addressing fentanyl and synthetic drugs as factors which drive infectious disease risks. And I would like to acknowledge our funders. Thank you very much.